Have you ever worried about a loved one getting the care they need, right when they need it? What if the future of healthcare meant that world-class medical support was just a click away, right from the comfort of their own living room? For many of us, watching our parents or grandparents get older brings a mix of love, nostalgia, and a little bit of anxiety. We remember them as the strong, invincible figures of our childhood. But as they age, new challenges arise. A sudden dizzy spell, a forgotten medication, or just a simple question about a new ache or pain can become a source of major stress, especially if a doctor's office is miles away or a visit means a day-long, exhausting trip. It's a feeling of helplessness we all dread. But what if I told you that technology is rewriting this story, transforming how we care for our elders and empowering them to age with dignity, independence, and grace? This isn't science fiction. This is the reality of telehealth, and it's revolutionizing senior care. Today, we're diving deep into the incredible world of telemedicine, exploring the innovations that are making healthcare more accessible, more personal, and more effective for our aging loved ones. So, what exactly is telehealth? Simply put, it's using digital technology, like your smartphone, tablet, or computer, to deliver healthcare remotely. Think of it as a house call for the 21st century. Instead of traveling to a clinic, seniors can have a video consultation with their doctor, a specialist, or a nurse. This simple change has profound implications. For someone with mobility issues, chronic pain, or who lives in a rural area, telehealth isn't just a convenience, it's a lifeline. It eliminates the physical strain and logistical nightmare of travel, reduces exposure to germs in waiting rooms, and ensures that consistent, timely medical advice is always within reach. Imagine your mum being able to chat with her cardiologist about her blood pressure from her favorite armchair. That's the power of telehealth. Let's hear from someone who's seen this transformation firsthand. Dr. Evelyn Reed is a geriatric specialist who has been integrating telehealth into her practice for the past 5 years. When we first introduced video appointments, she explains, I was skeptical. I thought we'd lose the personal connection. But it's been the exact opposite. I can see my patients in their own environment. I can ask them to show me their medication bottles, see how they navigate their home, and get a much clearer picture of their daily life. It's allowed for more frequent check-ins, which is crucial for managing chronic conditions like diabetes or heart disease. We can catch potential problems earlier, adjust treatments faster, and prevent unnecessary hospital visits. It's about proactive, preventative care, and it's empowering for my patients. They feel more in control of their health. The innovation doesn't stop at video calls. Let's talk about remote patient monitoring, or RPM. This is where things get really exciting. Imagine a small, wearable device, like a smartwatch or a patch, that continuously tracks vital signs: heart rate, blood oxygen levels, blood pressure, even sleep patterns. This data is sent directly and securely to a healthcare team in real time. If a reading falls outside of a safe range, an alert is automatically triggered. Think about the peace of mind this provides. For an adult child living hours away, it means knowing that a team of professionals is keeping a watchful eye on their parents' health 24/7. It's no longer about waiting for a crisis to happen. It's about preventing it. There are even smart pill dispensers that send a reminder to a family member's phone if a dose is missed, and fall detection sensors that can automatically call for help if a fall occurs. These aren't just gadgets. They are guardian angels, working silently in the background to ensure safety and well-being. Let's meet James, an 82-year-old retired teacher who lives alone. His daughter Sarah lives in a different state. I used to call Dad 3 times a day just to check if he'd taken his heart medication, Sarah shares. The worry was constant. Then, his doctor enrolled him in a remote monitoring program. Now he wears a simple wristband, and I get a daily summary on an app. His care team gets instant alerts for any irregularities. Last month, they noticed his heart rate was consistently low, and they were able to adjust his medication over a video call before it became a serious issue. I can't tell you the relief I feel. I'm not just his daughter anymore. I can be his daughter again, not his constant caregiver. Our conversations are back to being about his garden and his grandkids, not just his health. James adds with a chuckle, I thought all this tech stuff was for the young folks, but it's easy. I just wear the watch. It gives me a sense of freedom. I know someone is looking out for me, so I don't have to worry as much. It allows me to stay in my own home, where all my memories are, and that's priceless. And beyond physical health, telemedicine is also breaking down barriers in mental health care for seniors. Loneliness and depression can be significant challenges in later life. The thought of going to a therapist's office can feel daunting. Teletherapy provides a discreet, comfortable, and accessible way for seniors to connect with mental health professionals. They can talk to a counselor from the privacy of their own home, helping them navigate life changes, grief, or anxiety. Online support groups also connect seniors with peers who share similar experiences, creating virtual communities that combat isolation and foster a sense of belonging. This holistic approach recognizes that aging gracefully is about nurturing both the body and the mind. Now you might be thinking, this all sounds great, but is it secure? And how can my tech-averse parents possibly learn to use it? These are valid concerns. The healthcare industry is bound by strict privacy laws like HIPAA, and telehealth platforms use advanced encryption to ensure that all patient data and communications are confidential and secure. As for usability, developers are keenly aware that their primary users might not be digital natives. New platforms are being designed with seniors in mind, featuring large buttons, simple interfaces, and clear step-by-step instructions. Many healthcare systems and insurance providers also offer tech support and training to help seniors and their families get set up. It's often much simpler than you think, and the benefits of staying connected to care far outweigh the initial learning curve. So how can you start exploring these options for your loved ones? The first step is to have an open and gentle conversation. Talk to them about their health goals. Do they want to stay in their home as long as possible? Do they find trips to the doctor stressful? Frame telehealth as a tool for independence, not a sign of weakness. Next, talk to their primary care physician. Ask them what telehealth services their practice offers. Are they connected with any remote monitoring programs? Your doctor is your best resource for finding trusted, effective solutions. Finally, check with their insurance provider. Many plans, including Medicare, have expanded their coverage for telehealth services, making it more affordable than ever. The future of care is here. It's compassionate, it's connected, and it's centered around the patient. Telemedicine is giving our seniors the tools they need to live healthier, safer, and more independent lives, and it's giving families like ours invaluable peace of mind. It's about leveraging technology, not to replace human connection, but to enhance it, ensuring that our loved ones can truly age gracefully, surrounded by care, support, and love. Thank you so much for joining me today to explore this incredible topic. If you found this video helpful, please give it a thumbs up and consider subscribing for more content on health and wellness innovation. And I'd love to hear from you in the comments below. Have you or a loved one used telehealth services? What was your experience? Let's continue the conversation. Take care and see you in the next video.